We're starting the final session of the conference, and I just want to give you kind of the sequence of how we're going to go about it, so you are prepared for your role and turn when it comes. So first, we're going to start with reports back from the labs. We'll have six reports. We'll have 5 minutes each. Sharp, because we want to allow time for discussion after that. So we're going to have the report backs from the chairs, the moderators of the labs, 5 minutes each. Then we're going to have hopefully about a 15-minute discussion after that. Following that, we're going to have, we have prepared some slides summary for the conference, and we're going to present those, and then we're going to also ask you some questions as well following up that presentation. That is step 2. Step 3 is UNICEF and WHO are going to share a statement from them. And then following that, we are going to share with you the statement from the conference, and then have a final discussion and conclusion after this. So without further ado, I want to invite the speakers from the labs to please come to the podium. I'm going to ask you to speak, to come to the podium, but I'm going to ask you to speak from here because we're not mic'd up this afternoon. So can I have the chairs, moderators of the panels, of the labs, please, to come to the podium. So 1, 2, 3, okay, 4. We're missing 2 or 5. Okay, this is gender imbalance, but that's okay. Okay, who would like to vote? Maybe we'll start with you. Ready? Okay, please come to the podium. You have 5 minutes.
So I'm representing the Modern Data Analytics Innovation Lab, and we talked about emerging technologies in modern data analytics, everything from model estimates to artificial intelligence to using proxies for civil registration, such as sample registration systems and verbal autopsies. And these are some of the key, we use mortality statistics, particularly causes of death, as a case for discussing these emerging technologies and emerging modern data analytic tools. And this was some of the key issues that was brought up, followed by action items and possible next steps. So one of the main issues was brought up was how to increase death registration via creating incentives for death registration. What are some of the areas we can explore for this? Intentional misclassification of causes of death and reporting of the same to address health programs and health program funding. How should this be combated? Where is death registration high in high-income countries and other middle-income countries where the number of death registrations have increased? Now there should be more focus on quality of cause of death and how to improve that quality. There are country pressures to use model estimates versus direct administrative data collected. How should countries resolve this pressure? There's limited requests from country level to collect mortality data because some of the reasons for this includes working directly with the Ministry of Health, which is focused on disease programs rather than collecting mortality data. And some methods to increase demand and country ownership of mortality data could be GFF and other investment cases that are being developed, quickly generated proof of success, example, generating national mortality, maternal mortality reports, working directly with consumers of data to better align short and long-term goals with plans to collect mortality data. Also, the idea of considering social autopsies in conjunction with CRVS systems to address health system gaps without overburdening the CRVS system, if that's possible. In high-income countries, one of the gaps that was identified was the idea of collecting more immediate and timely data, so moving away from having the routine data and the routine publishing of data collected quarterly or annually, but for example, in the opioid crisis, currently having more timely data available and methods and solutions to allow for this timely data. Another point that was brought up, that the initial startup cost for creating these systems will be high, but the general consensus was that the long-term running cost will be sustainable at the country level. Some of the outcomes of the session where consensus was reached was that there could be many data sources within a country, for example, sample registration systems and death registration from multiple sources, police records for road traffic deaths, and it is possible to integrate and harmonize this data such that you get a nationally representative picture of mortality in the country. Some actions and more at the policy level, long-term, and questions to the group are, should we consider certain priorities in CRVS that can be achieved by 2030, or should we be focusing on all aspects of CRVS, from marriage to death registration in 12 years for the 2030 targets? Should WHO act as a custodian for standard settings and guidelines on mortality data particularly? Can we involve national statistics offices at the table for developing these investment cases, given that they have extensive experience generating census and national reports? And should they be a bigger player at the table than they currently are? And can IDRC and other organizations have a strong role in facilitating capacity building and a strong learning agenda such that the systems we build in the near future are sustainable in the long term? Thanks.
Thank you very much. Irina, are you ready?
Yes.
Okay, how many recommendations do you have?
Oh, many.
Okay, good. 5 minutes.
Okay, I'll try to stick to 5 minutes. Hi. Actually, I was part of a human-centered design innovation lab, and I have to tell you that the discussions around the table were very passionate, and we were very, very lucky. We have built the innovation lab in such a way that we are looking at the challenge of what human-centered design is, and we have taken a case from West Africa. This is Guinea-Conakry, mainly because we are very focused on Guinea at the centers level also, but I think that it's also an interesting case for all of us. And we have tried to challenge the audience to engage and respond to 4 questions which we believe are relevant to human-centered design. And the questions go around which would be the quick wins, the low-hanging fruits for to improve the systems actually and make it more human-centric. And the second one was, what are the modifications that they were thinking are necessary within the legal framework so that the legal frameworks are a little bit more human-centric. The third one was going around communities and how do we partner better with communities actually to ensure that they declare all the vital events that happen within the community. And last but not least, what are the steps needed to change the social norms around vital events? And I would say that this is a big piece in itself. So the discussions were very active, to say the least. And we have come to some recommendations and some conclusions and have listened to some experiences of colleagues, we have learned from Ethiopia, from Pakistan, from Afghanistan. Colleagues from Europe were also sharing with us, I think Bangladesh and so on. The discussions were very rich. So I wouldn't say it's consensus, but there are a couple of ideas which were emerging from both labs, which I try to synthesize in the best possible way. And we have come to the conclusion and to the agreement that unless comprehensive assessments are done, quick wins are not possible. And actually, we should not only look at the quick wins, but build the capacity of the governments to lead the comprehensive assessments, which would be very, very important in the future as well in terms of ownership and leadership for the government. And then another issue is the issue of passive system, the whole discussion around passive system and active system. How do, the system is also going to the people instead of only the people coming to the system, and how do we also modify the legal frameworks in a way that we are making them a little bit more human-centric? Around the communities, one of the recommendations is to leverage the power of the communities and partner with them, also give them feedback if possible in the assessment and the design of the system, and also ensure that the gender, because we talked about gender the other day, and I think that there was some recommendation to look to all the processes through the gender lens, to ensure that gender and minorities and other underserved population are part of this. And then we came, because all this challenge around Guinea was very much around what data was available and generated from incomplete CR and also from the mix, whatever, and the census, whatever was available. And the consensus was around investing in research and generated evidence, both qualitative and quantitative, to design not only plans and strategies, but also looking at the demand side and designing evidence-based measurable communication plan for behavior change in the long term for the population. Another thing which we were looking for is how to really leverage the other systems, like, for example, the health system, to improve the coverage. I'm coming back a little bit to the legislation. We were discussing a lot about the fact that the countries who ratify the international conventions where there are mentions related to civil registration, such as marriages and births, for example, should amend the national legislation accordingly. And when it comes to birth legislation legal frameworks, they need to ensure that the state fulfills the role of guaranteeing the right to identity for all. We also came to the conclusion that institutional frameworks and legal frameworks should be aligned to facilitate the beneficiary, and data protection and privacy are core, and the national governments should address the matter into their internal legislation and in practice as well. Another recommendation is that we should have better documentation of best practices, addressing the linkages between cash transfer programs, for example, and improving coverage programs with pensions as well. And last but not least, support and capacitate the national government into the implementation of CRVS systems and address the issue of border population and nationality. That is a little bit all.
Thank you very much, Irina. 5 minutes exactly. Teresa?
So I'm reporting about the Health and CRVS Innovation Lab. And first I want to explain how we did the lab. We use this fishbowl technique, and the fishbowl technique is when you put people in a circle in the middle and you require people to come in and out in order to participate in the conversation. And we presented the group with a case study of a fictional country called Swaziland, but Swaziland had a lot of problems. Swaziland had a lot of home births, home deaths, did have a functional health system with a DHIS, and then we added high vaccination rates to that, but also had a CRVS system in which it was mostly paper-based, required persons to go far away in order to register and to pay for the registration, among the multiple other problems that Swaziland had. And then we just went through and tried to come up with solutions. What are the possible solutions given the scenario that we had given to the group? So first, for birth registration, there were several solutions that were suggested. One was SMS notification by community health workers, midwives, and community leaders, decentralizing the community registration system to the lowest levels. Community engagement was felt to be important to increase the demand, and also including the men. Needed to reduce disincentives such as distance, fees, and the complexity. And we need to increase incentives, needing to have a birth registration for school and other services, but also maybe giving something like a baby pack if you were to go and register births. Link with the lowest levels of the health centers, including having the registrar in the health centers. Review regulations and form to simplify. Provide temporary documents at birth or immunizations which we can use to obtain a birth certificate, a proof of birth. Use your immunization card as your proof of birth, that ultimately getting a registration birth certificate at a later date. Make sure that birth certificates are the only approved ID for children. But don't, and then as far as community health workers, don't overburden them, but make it part of their job in helping them to improve to provide the services to the community. In regards to deaths, there was a suggestion to make mobile or community level registrar CRVS teams. Use the existing health information systems or maternal death surveillance and response and perinatal audits in order to improve the reporting of death and causes of death. Use mobile register from communities, mobile reporting, notification from communities and health workers. Use local leaders or religious leaders to notify deaths. Use verbal autopsies from community health workers in order to improve the reporting and cause of death. Use community data for a social accountability, actually sharing the results of the death and causes of death with the community in order to get that kind of participation. Have incentives for notification, for example, death notification, you get some kind of benefits for burial or insurance. And healthcare workers or other community members need to be designated as registrars. But I think one of the key issues or key points that someone made was that in the CRVS system, there is a lack of trust that local leaders or community health workers can actually do reporting. And we need to break that belief, and we at least need to start somewhere. Thank you.
Thank you very much. Thank you very much, Teresa. Jane, you have a flip chart. Someone forgot their pen.
It'll be a challenge for me to manage this. So we were the blockchain group. We also had very lively conversation, but one of the things that became pretty clear right away is nearly everyone who came into that conversation knew next to nothing about blockchain. So we had to spend quite a lot of time with the groups just trying to help them understand what it is. And I think our ambition by the end of it was that they would be interested enough to go and learn some more about it. But in terms of both of the groups, the discussions that we had were along what is it, how does it work, how might it be applied, not just to CRVS, but to other of the major global problems that developing countries are facing. So coming out of the recommendations, I think that the first thing was people don't know enough about it. Governments don't know enough about it. People don't know how to deal with it. So the first recommendation that came out is that there's a need for education and further research. And the second group actually suggested that perhaps what could come out of a recommendation of the conference is actually doing a white paper on blockchain and CRVS, because a lot of people had worries about it, of course. They were worried about a whole range of risks, some of which were easy to dispel and some of which we don't yet know about because implementing this at scale is not something that anyone's done anywhere. So that was the first thing, and sharing more information. So we'd like to propose that we could share some information from anyone from the conference who'd like to learn some more about it. The second thing is, how do governments think about testing this technology in a safe way without creating risks for their population? So we talked about regulatory sandboxes. A number of countries have already set up regulatory sandboxes where you can test this kind of technology in a safe way and explore how it might work in the particular context of the country. People naturally were concerned about compliance standards regulations, so there was discussions about that. And what we would like to propose coming out of the group is that this is something that a lot of different countries are thinking about and working on, and if there can be some kind of collaboration between different countries and groups that are working on it, then it's going to help the other countries to understand what are the risks that you need to be aware of and what are some of the regulatory and compliance regimes that you're going to need to put in place to be able to make this safe and sensible for your population. The other issue that came up was needing to show people examples of how this could work and how this is working. So there are a number of developing countries that are already working with this technology in a number of different ways, but being able to show that to other people so they can see what this works. So to create some sort of repository of proofs of concepts and encourage proofs of concepts so people can see how it could work. And then I think that the other two points that came up, one was, will this work for the bottom billion? And the answer is yes, but we need to show you that. So, I think there's some information sharing that would be helpful to this community to understand how it could apply. And then the other one was about what is this going to do for equality, inequality. And again, there's a whole smart contracts function that we need to share information with you about that. So I think one of the takeaways is people need to learn more about this. People need to think more about this. I hope perhaps IDRC or someone else can create some research around it to help people understand and share some of the proofs of concepts, because I think people left believing this is a transformative technology, although there were a few doubters. And I think enough people are going to start learning about it, because the one thing, and I want to say it because we all know it, this conversation's been happening every year for 2 decades, and it's the same conversation. So we know there's still countries that have got 2% or 10% of their populations registered. So keeping on doing what we've been doing for the last 20 years is not going to transform anything. So it's worth spending a little bit of money and time just to explore technologies like this that could be transformative. Thank you.
Thank you very much, Jane. I guess the moral of the story is don't say no before you try it, okay? We'll try it. Ed, please come in.
Thank you very much. I think the sentiment, don't say no before you try it, I'd love to apply that also to Open CRVS, which is the subject of our conversation, but I won't misquote you there. Our session, so thanks for the participants who took part. It was very sort of interactive. We got people co-creating and following a human-centered design approach kind of for real actively as part of the session. So this is as part of a session which is about digital CRVS as a global good, namely using the concept of open CRVS as a basis for that. So open CRVS being the concept of building an open CRVS solution, freely available, open source, fully interoperable and standards-based solution as a common platform for multiple countries to use. And we've been building a prototype of that solution and demonstrating it in previous meetings. So we ran 2 sessions, one in English and one in French. The French one rather more simplistic due to my language abilities, unfortunately. But the first, and thank you for the Francophone audience for putting up with my poor French. So firstly, the first group, what we did a co-creation session, which was taking OpenCRVS, the concept, and thinking through from the perspective of 3 specific users, a mother with a newly born child, a health worker, collecting birth registration information in a community, and a registrar at a city registration office, all within the Bangladesh context. And we created some persona profiles for this meeting so people could really sort of get into the hearts and the minds of the people who they were designing for, which is very much the approach which we propose for designing systems, whether it's OpenCRVS or any other, really sort of understanding with the users in mind. And so we did that, and we built out. In fact, we gathered requirements from the group. We got the groups to think about, what were the system requirements which would start fulfilling the needs of these users. So that was incredibly helpful for us as we think through the perspectives of how we build OpenCRVS. A couple of comments, things which were discussed, in particular in the second group where we had a more general conversation. Conversations around how to focus on the records and legacy systems, how they can be migrated into Open CRVS, and how mass registrations can be done to complement the continuous registration process of Open CRVS, and also the need for very quickly for a reference country implementation of Open CRVS to build buy-in and show how it can actually be implemented on the ground. So that's very much taken on board, and hopefully next time we meet I'll be able to present on how that has gone. So outcomes of the session, what we really learned and we're taking away. So I think there was a consensus that CRVS services, in particular technology services, should be designed not only to respond to needs of users, but also we should set the bar really high to delight users, to provide data in ways of data visualizations, for example, which really empower them and allow them to do their job. So that was a really key outcome. Taking a human-centered design approach to system requirements development is providing really useful insights that are often not unearthed in traditional CRVS system design processes. So I think we started to gather new requirements because we really reflected on what were the needs of the users and trying to delight them. There's a clear need for CRVS systems to be designed with data protection and confidentiality at the center. I mean, that comes through strongly as ever, providing users with the option of what data is and isn't available to governments. A number of participants also acknowledged the need for Open CRVS and are interested in implementing components of the solution, which is great in their country, and or testing out interoperability between their existing systems and components of Open CRVS. So that's optimistic going forwards. And a number of useful and innovative system requirements can be derived from the human-centered design exercise that was conducted as part of our session. So three actions to take forwards, potentially as recommendations. Practical guidance on human-centered design for CRVS systems building should be developed by appropriate actors and could be developed as part of or incorporated within existing documentation like the CRVS digitization guidebook. I think that'd be a good place to, we have some basic information of human-centered design, but we can certainly flesh that out more in detail. Second point, there's a clear need to develop interoperability standards. Certainly that's a necessity as we build Open CRVS, but that could be done within any context. We need those standards to be built such that we can make interoperability between, for example, health, civil registration, national ID systems, reality, rather than saying that's something we need. And thirdly and finally, develop a technical advisory group of relevant stakeholders with different skills and interests to support the development of Open CRVS as a global CRVS good. Thank you.
Thank you very much, Ed. I couldn't help but notice the unicorn on your laptop, so hopefully it's not a sign of things that are impossible, but of what is possible. Please come in.
Yes, thank you so much for the participants who joined our group. Our discussion was around the application of business process improvement to transform CRVS. The root of this discussion is based on the fact that most of the activities of CRVS business processes are performed by various actors who belong to different ministries, departments, and agencies. And these groups operate vertically in silos. As a result, you have fragmented business processes, which are very inefficient and very ineffective. Then our hypothesis was that to transform CRVS can be achieved by transforming CRVS business processes. By business process, I mean the set of activities which are performed to realize a particular goal. If your goal is to complete the registration, there are several activities which are performed. One is the event has occurred, the birth has occurred in the community. Then there are a number of activities which are to be completed to realize the goal. Now, if you want to transform CRVS, we hypothesize that you can only achieve that by transforming the process, which implies understanding the process, analyzing it, to understand the bottleneck, and then redesigning it to address the challenge. So we started by presenting a structured approach to business process improvement. And then we went on to introduce 2 case studies. One is Tanzanian case study, another is a Ghanaian case study. And then later we discussed some talk points where we talked about how can we effectively raise the in-country capacity to apply BPI approach. We also talked about how can we design an effective BPI governance within existing CRVS governance structures. With this, we wanted to see that there exist governance structures of CRVS, but if you want to change a process, you cannot only involve technical people to change a process, because you need support of top management or executive. And this executive, some of the countries, there are ministers, some of their cabinet secretaries, and some of CEOs. Now, the idea was how can we make sure that this group is also on board on the business process improvement. The next talk was how can business process improvement be adopted by different countries with different CRVS maturity levels. Also, we talked about how can the global community support the implementation of BPI to strengthen CRVS redesign. The outcome of our session, actually, the first was to test our hypothesis. As facilitators, we agreed that the participants agreed that the potential benefit of using business process improvement as an approach to improve the efficiency and effectiveness of CRVS systems. Then participants also indicated that they need to create in-country capacity to support the adoption of BPI approach to support CRVS system transformation efforts. Also, participants indicated the need to establish business process improvement focus groups for effective governance of business process initiative in a country. With this, the idea was that many of these initiatives have been involving technical people, and at the end, a process needs to be changed. For example, in Tanzania, we had some changes, but this requires legal framework change, which is done by cabinet secretary. So the idea was to have support of steering committee as well as the technical team. Another was to showcase the successful case studies of the application of BPI approach to CRVS strengthening. Action, development of BPI training packages to various groups ranging from executive, CRVS expert, and IT expert. Then create a community of BPI practitioners that know CRVS who can support the country. Thank you.
Thank you very much. Thank you very much. We have time for maybe 1 or 2 rounds of questions, if there are any from or comments from the audience. And I'm going to give you this. I'm assuming it's working somehow. Oh, it's working. So we'll just keep it there. So questions, comments? Annika, please, the microphones.
Just to also say that yesterday at the digital, where's Martin? Yesterday at the digital session, we also thought that something that was really important, there you are, sorry, talking for you, was about the shifting paradigm about identity, and particularly through some of the technological approaches that are coming out about individuals having their own ability to manage their own identity and where and how it's used. And we thought this was kind of fundamental. So yesterday we thought that a good piece might be to, I'll take the comment about the white paper, to potentially have a white paper on, some of the challenges that are kind of fundamental and that are coming through at the moment to identity. So, yes, more functional digital identity, but still important in the whole discussion.
Thank you very much. Other comments, questions? Okay, everything is clear. I guess the labs really were very effective. Okay. Okay. Okay, well, thank you very much, our panel, our moderators. Thank you very much. So we now go to the next section, which is the presenting some of the slides to reflect some of the points that were raised during the conference. And if I can have those on the screen, please. Okay, it's not, this one is not working. What did I do? Did I switch the whole thing off? Okay. Okay, maybe I'll just read them from here. I don't want to bore you with reading, but I think it's for also the interpretation for others, because we only have the slides in English. So I'm going to read to you some of the points, and then we'll invite discussions and feedback afterwards. So basically they are framed as kind of what we heard. This does not necessarily mean what we all agreed to, what we all bought into, or what we all committed to, but it's what we heard, and hopefully it kind of summarizes some of the main points and things we would like to see going forward. So what we heard is that CRVS systems need to be designed to work for people, human-centered, to work for people, human-centered design. And I think Irina just mentioned that as well. The disaggregation of data by sex at the very least is fundamental. It is kind of a surprise, a shame in a way that we don't have that accessible, available for everything that we do. We need to build a strong, clear business case to be able to explain how the benefits of investing in CRVS systems outweighs the costs, economic and otherwise. I think this was said many times in the last 2 days. Systems need to be developed that can operate in and help respond to conflicts and emergencies. I think this also reflects some of the important discussions that took place yesterday in the panel on that subject. The next one. We also heard that innovation is not about technology alone. It's about identifying new ways of working to build or strengthen the fundamentals, approaches, partnerships, social inclusion. And this also kind of ties into the point that was raised yesterday about the benefits of CRVS systems, the multiple benefits or the ripple effect of strong CRVS systems. Technological innovation is not about the technology in itself, but in its application as well. And I think maybe, Ed, maybe that kind of corresponds to your point as well. We need to see it on the ground, things on the ground, and see how they work and benefit from application and to improve the technologies. This requires coordinating across sectors and partners to support priorities defined by countries themselves. Country priorities, countries' national plans, countries' systems is, of course, at the heart of everything that we do. We need to learn from and share successes which overcome context-specific challenges. There's no shortage of challenges, but I don't think we need to necessarily deal with challenges every time as if they are unique and unseen challenges. Many of the challenges are similar, and we can learn from each other and from past experiences. We also heard that the need for localized solutions, but that can benefit from regional and global learning and experience. How do we do this in practice? So making the whole continuum between the local, national, regional, and global. How can service provision be enhanced to create demand for CRVS systems, incentivization? And I like the comment that was mentioned earlier today, I think by Ricky, that it's not only just about, the choice is not just about the women, whether the women or people go for registration or not, but are there systems, are there government systems that make it actually easy and useful for people to go, or beneficial for people to go to do the registration. In conflict and emergency settings, how can the systems of international agencies and partners be interoperable with existing national systems to avoid statelessness and other negative consequences? I think this is something that we're seeing every day, and it came out from the examples from Syria and from Bangladesh for yesterday and today. Recognizing the potential of integrated systems, how do we ensure data protection for populations? And I think this is one of the things that was raised yesterday by some people, that this is maybe some aspect in terms of the protection, data protection and privacy and ethical issues were maybe something that we didn't really elaborate on so much in the conference, but hopefully in the future this becomes the subject of future debates and discussions. We also heard data protocols and privacy issues must be incorporated into legal frameworks. We need to move from the concept of awareness to a real participatory approach of partnering with communities and stakeholders to design systems, adopting a participatory and behavior change model. And I would add to this one from the conclusion from, or the outcomes from the gender and the CRVS meeting we had on Monday, is that this is also a real participatory approach and partnering with not just with communities at large, but also with women in particular, and women agents and the community as well. We need to develop consistent global guidance on integrating CRVS and unique ID systems. This was repeated, and I would say this is really one of the big take-homes from this conference, for me at least, is the whole link, or the potential, the opportunities for linking ID systems, CR systems, and VS systems, and health information systems, how to make all the connection between all the different systems and different investments that are that take place by governments as well as by donors in those various systems. How do we really make this align together and have a consistent global guidance for it? We need to analyze what we collect and publish what we analyze. This is not unique to the CRVS sector or field. There is a lot of knowledge that sits in drawers, that sits in people's heads, and we need to really get that out to accelerate good practice and solutions. In order for CRVS systems to work for all, we need to move from analyzing to taking action on addressing gender inequities. And I think this is very much aligned with what we talked about, what came out of the meeting on the gender and CRVS meeting on Monday, which Shahida presented on this morning. Now we go to the next one, which is, we would like to hear more from you. So this is, what we heard. This is kind of summary points about what we heard. But we really want to hear further from you. What did you hear? We want to see, are these the same things that you also heard? Are these the same things that you are going to be your key takeaways to take home to your organizations and to your work? And what are you going to do differently after this conference? Probably your life is not going to change drastically, unless you want to. But I think hopefully there's some learning. Every yesterday and today, hopefully there's some learning that will make a bit of a difference in how we do what we do. So I want to invite people to really respond to those questions, and we're going to have time for this. This is also another reason why I went quickly through the slides, because we want to hear from you. So what did we hear? What did you hear? We have mics ready for you. We have 3 mics. Please, Jonathan.
Thank you very much for the summary. It was really good, and I know firsthand how difficult it is to summarize these things in the middle of a conference. I think one thing that perhaps, in addition to what was presented, coming back to a point that Cornelius mentioned last night in the session on digital innovations, that any kind of introduction of innovation requires a foundation, let's call them analog foundations of institutions, legal and regulatory changes to enable that, particularly ready for going up to scale. Of course, there's regulatory sandboxes that can be used for, testing things. But in order for any interventions that we're doing that are promoting innovation, there's some very basic fundamental things that need to be in place. Capacity, the institutional arrangements, the laws, the regulations, the business processes, etc. Thank you.
Jonathan, maybe while you have the microphone, since you're the only one who volunteered so far, not to put you on the spot, but is there anything that you think you'll be doing differently going back? Again, I'm not putting you necessarily on the spot, but you are on the spot, so
okay.
Please.
So I think certainly there is I think there's more that we can do on the World Bank ID4D side to more clearly articulate that integration between CRVS and ID. I think there's been some misunderstandings, and I think that message is being heard, that we are indeed on the same page, but I think we can be more nuanced, and we're very interested in working with the Centre and anyone else on this particular issue because it's very important. And I want to come back to Canada again. Thank you.
Good. We'll try to. We were lucky with the February weather, but hopefully we'll come again at a different time of the year. Other comments? What did you hear? Please go ahead.
Thank you very much, and thanks for a fantastic couple of days here in Ottawa. I think from the last session, actually, really, in the blockchain session, I think, we've got a fantastic community of CRVS practitioners expanding into ID. But I think what was fantastic about that session was you're bringing some real disruptors, right? People who are looking at these kind of different problems in different ways. And I think as a community, looking at CRVS and trying to innovate, we should continue to try and bring in these different actors who are going to force us to look at the problems in a different way.
This is great. So this is what you're taking home with you?
Absolutely, yeah.
Okay, great. Shaida, please.
Thanks. It's been really wonderful past few days and so much learning and takeaways. It's just overwhelming knowledge. My one point that I wanted to stress a little bit more is that we all now know that how important it is to stimulate the demand side for CRVS. And we have lots of things coming up, with the action plans of, open government partnership with, lots of emphasis on gender issues with SDGs and countries reporting, monitoring and achievement for SDGs. So it would be really good that among us we connected all these dots. So in all these new demands for data and knowledge, we would remember that CRVS is a foundational system that we need to keep in mind. So build the demand and mention CRVS. That's what I'm going to do. Thanks.
Thank you. Thank you very much. That's great. Please.
Je vais parler en français.
Oui, bien sûr. Yeah.
Merci beaucoup.
I speak French. Thank you very much. I think I'm going home to Cameroon, and I will see things in a different lens. I appreciated that we were able to talk about the demand for such statistics. We've been talking about this in a holistic approach. We have to look at the marginalized people as well, refugees or migrants, and in my country, but also in neighboring countries. That's what I'm bringing back home. Excellent message. Thank you very much.
Is anyone else committed to doing something different, even a little bit different?
Now, I was in the session on business process assessment. And for Guinea, we've just completed our CRVS assessment, a comprehensive, using the existing applied CRVS tools. We developed a strategy with, a budgeted action plan, etc. But, when I attended the session, I think it's really eye-opening. We definitely need to take maybe a step back and really look further deep into how these systems exist. The idea would be, of course, using what we know already and see how we can build on that to further understand how the whole process really functions, identify bottlenecks, and then take it up from there. I think for key actors involved in the whole CRVS system within Guinea, it will be very interesting. It's very concrete, and definitely it will speak to them. Thank you.
Thank you very much. I really, thank you very much. This is really very, I think, a very nice takeaway. I think, which is we don't have to reinvent the wheel all the time. There are some lessons and experiences. And hopefully, while you are here, you made some connections to at least know whom to ask or whom to go to if you have a question about something. Hopefully, that was a takeaway benefit for many of you. I see nodding heads. Is that networking was useful, was good? Yes? We didn't have enough time for... the reception was a bit short, the coffee breaks were a bit short, but you still managed to do that. Okay. Maybe any other comments, responses? Please, go ahead.
In terms of doing things differently, we certainly from where I work in UNDP, we would hopefully be able to commit to continuously trying to remind countries that ask us to introduce national identity registers or national ID card schemes with very, very high technology in them, to continuously ask them, are you going to link this to the base CRVS system? Because if you do not, then this investment is not worthwhile. That you must first fix your CRVS and then build an identity system on top of that, rather than doing it the other way around. And a point we often say in the context of in the context of ID card schemes that are based on no base CRVS, that creates the possibility that you can move from low technology fake identity to a high technology fake identity. And that's something we must avoid. And then secondly, in terms of the one, I really learned a lot in the blockchain session this afternoon. And the idea that there are new technologies out there that can build trust between users across a system like that has a massive potential, particularly in contexts, I feel, where there is a state agency on one side and stakeholders on the other side, and there's a complete lack of trust between both sets of stakeholders. And if technologies can be introduced that will allow people to be able to verify transactions from one side to the other, then that does, in an area I work in primarily like elections, that does potentially have an enormous benefit. Thank you.
This is great. Thanks very much. Yeah, wonderful. Other comments? John, please.
Yeah, well, I just want to thank the organizers, but also to say I'm coming away from the meeting with, having been at WHO now for 6 months, with a better understanding of kind of the broader ecosystem around CRVS. And I think that it's also been really good to hear from people, either through different meetings or in the hallway, how we're still needed. We're still in demand. We're still the custodian of health information, and we're the steward of that information. And I think what I'm taking away is two things, is kind of a two-way dynamic. One, this group can help to pressure the health sector to be a bit more harmonized, and to help remind us to reach out beyond kind of our usual remit and our usual players, and to reach further in countries to be part of the broader discussion. And then I think likewise, I'm still convinced that we need to fix the graphs that I showed on the first day. That we still need to make sure that we're really tracking births, we're tracking deaths, and that we're doing everything we can to change what that looks like over time. And so, thank you.
Thank you very much, John. So that's a commitment there for that. Other comments, responses? Yes, please.
One of the things we also talk about is the sample registration system, and how we can use it as a stepping stone to accelerate completeness of the civil registration systems. So we are doing this in the country, and we're glad to emphasize and reinforce that as going forward as part of the COMSA project. I'd like to also to emphasize the need for, and maybe this didn't come up in your point, but the need for periodic assessment of systems that are being implemented in order to assess progress and share learning all across, so that we can from across countries be learning what the systems are, what the progresses are, and how things can be fixed, what are the best practices, and so on, so that all together we can reach to a better, more complete system. Thank you.
Great. I think what you're also, what I'm hearing you saying is that there is also a need and a benefit from learning about what worked in other countries and how systems or how interventions worked, or how new experiments worked, to see what worked and how we can spread that knowledge outside of the particular specific context. I'm going to leave it at that here because I'm also trying to stick to the time, but thank you so much. This has been really very, very helpful for us to make sure and validate or complete the picture about what you have heard, what we have heard, and to make sure that they're consistent with each other. So now we move to the third part of this session, which is WHO and UNICEF presenting. I don't know if I can call it a surprise. I don't know. But anyway, they'll present something. Okay, good. It's not a gift. No take-home gifts, but...
Hi, we're going to take turns. I can't see it there. Oh, well, that's all right. I'll just use this. Can you turn that one on? Thank you. I'm Deborah Jackson from UNICEF, and okay, thank you. I can't turn it on. Never mind. My tester, she said you can't turn it on. Okay. Oh, okay. I think from a couple years ago, from the health side, WHO and UNICEF really wanted to start to get. You can go to the second one, because I also don't have a clicker.
That's right.
There we go. There's the clicker. All right, got it. Really wanted to start working together. UNICEF has traditionally always worked on birth registration, marriage registration. WHO's done death, cause of death. Never the two shall meet. I think we really were trying to get together and bring health to the CRVS table through help from our data colleagues in WHO and our child protection colleagues in UNICEF. And so basically the background is that we feel that civil registration of vital statistics serves as a means through which fundamental human rights can be realized, and that as human rights are a social determinant of health, that's something that's important to us, and that the health sector is crucial for securing long-term improvements to CRVS systems. So getting our health colleagues to recognize that. The two. And so basically we started working together along, and then the Center of Excellence came along, and we got other donors interested, Gavi and Canada and all of those, to sort of put these two pieces together. And so what you see on the next slide, I'll try to do. I think I don't have an angle that's going to get it done. Okay, thanks. Sorry for the technology things. And so what we have in, what we started conceptualizing was the continuum of care, and that we have this, just like in CRVS, you have that sort of life cycle approach from pregnancy, birth, all the way to death, and all the little points that come in between. That we have a similar thing that healthcare in general across the world has started to think about life cycle and approach, and it's a continuum of healthcare. And so we wanted to look at, in particular, where in the continuum of care do CRVS and health intersect. And obviously, we're looking at pre-pregnancy and pregnancy data. We're looking at birth, data from the postnatal period, data from infancy and childhood, and then, of course, obviously, then later on through points of the life where someone dies and interacts with the health system. And so we're looking at a continuum of program data, which often, for us, goes into a health information system, and can be a rich source of sharing with the CRVS system and for population data. So I always say that health providers, if you're talking about birth, death, or stillbirth, or cause of death, that the health providers are the usual source of that data. We are also the primary users of that data. And so we have to be engaged with the CRVS colleagues in the middle to get the registered, to get the vital statistics that we need out. And in particular, I think a lot of our partners are interested because of the whole population data issue. If we're going to measure our health programs going forward with, for example, in the SDGs, we need denominators. So Teresa's, what we did is we had a meeting a couple years ago, and not quite about a year and a half ago, and we came out with and we decided that UNICEF and WHO, as two primary health-related organizations, needed to come out strongly to our health partners that we work with, that CRVS is something we should work at. And so Teresa's going to present our statement, and we would appreciate people to join on our support and share our statement with your health colleagues when you want them to work with you.
Can you press the next slide? Yes. So our statement, in line with our commitment to the SDGs and vulnerable populations, especially women and children, UNICEF and WHO will work together with governments and partners to strengthen CRVS. To achieve this, we will lead with joint strength. We will build our respective strengths to support countries to develop and implement evidence-based strategies that address the health and developmental needs of women and children, especially during crucial times of birth, pregnancies, and childhood, and contribute to scaling up to CRVS systems. We will collaborate for innovation. We will collaborate in introduction and assessment of innovative approaches, new tools, technologies, and support linkages between CRVS and interventions for women and children in all populations across the continuum of care. And we will advocate to countries for equity. We will advocate to countries, development partners, donors, and civil society in the critical role of CRVS systems in addressing the health and developmental needs of vulnerable and marginalized populations. The next slide. And we will take action. We will share expertise, with information, data, and technical expertise. We will reach out. We will work together along our health and multi-sectoral partners to strengthen information systems. We will collectively learn. We will learn from experiences in countries to enhance coordination. We will mobilize. We will mobilize human, technical, and financial resources to support CRVS systems. And we will link. We will work together to ensure that our work, and we do a lot of work in the area of mortality surveillance, such as maternal death surveillance and response, perinatal death audits. We also collect data on household surveys, such as MICS. We have pregnancy registers, immunization registries, health management information, verbal autopsies, and we will increasingly link those to CRVS systems in interoperable manner. Next. So this is a joint statement. Joint statements are, for us, are ways of making a statement to the health communities, and we invite other health partners to share in this commitment. Thank you.
Copies were circulated yesterday. If you didn't get one, I've got hard copies, and I think it will be put on the conference website and on the UNICEF and the WHO website if you ever need it to give to one of your health ministers.
Thank you very much. Any questions, comments for WHO UNICEF, other than congratulating them for this wonderful initiative and for choosing the right time and the right place to launch it? Thank you very much. Now we come to the next segment, which is a presentation on our conference statement, or the status of our conference statement. And okay, here we go. I'm not going to be the one presenting that, but except to say that this statement, which you have seen the draft of, has been slightly modified just to add more context and background to it, to reflect the discussions that took place in this conference in terms of the number of issues and the range of issues that need to be that reflect the discussion that took place in the last 2 days, and also maybe more specifically or specifying some of the roles and some of the calls for action or for opportunities for action that we got feedback on in terms of highlighting it or specifying it in the text. So I'm going to invite UNSD to Surgeon to come and speak to the action items on the statement. We're going to, there needs to be just some final language cleanup on it, so we're going to hopefully do that tomorrow and hopefully get that up on the website in the next day or two. So, but please.
Thank you, Montaser. Dear colleagues, we are almost at the very end, and for the statisticians in the room, we always do like some numbers. We do have over 140 participants here at this conference, which is remarkable by itself. We did have 10 panels. We had 12 lab sessions, all squeezed into 2 very intense days. So we can say that the conference, measured only from these numbers, already achieved extremely lot. What before coming to the case in point, which is the strategic messages that we would like to convey as the outcome of this conference. Just by the way of reminding all of us that we have discussed the civil registration and vital statistics, and we have discussed the identity management system, we have discussed the health, especially the causes of death, and under each of these items, we did further elaborate on the registration of births, registrations of deaths, registration of marriages, were particularly a case in point. Among all of these, we did have the cross-sectoral issues that we have discussed at length, like technology, that is really applicable in all the different phases of the registration process. We have discussed the legal framework. The role of governments, what do they have to do in order to ensure that no one is really left behind by 2030? What are the necessities in terms of establishing the systems that really register all the vital events? We did discuss this at the global level, what has to be done at the regional level as well, and then at the country level equally well. We have success stories, which is really extremely encouraging, and this is something that also guided all of us in putting together the kind of priorities that we would like to see as an outcome of this conference. And these are presented on the screen. I'm not going to read them. I would just like to emphasize a few points there, that one of the major outcome that we would like to see out of this conference is developing a global plan for strengthening CRVS that focuses on innovation and technology. We did hear a lot of success stories when innovation made a difference. And this is not only innovation in the phases of technology, this is innovations in the phases of operational activities and in the way we approach the philosophy of registering of vital events and producing vital statistics. So that's the principles that we would like to outline there is, as I said, the role of the government. So it has to be owned by the governments, the country ownership and leadership of the development, and essentially a commitment to scalable and sustainable solutions using innovative processes and technologies. There are several points that we would also like to present here in front of you, and those refer to the fact that we really hope that this conference will help us promote regional and global collaboration and partnerships. We did have here around in this room representatives from really extremely wealth of institutions, organizations, regional, global, countries, and this shows us that such kind of collaboration is possible. It just needs to be started, it just needs to be nurtured, and it needs to be essentially applied at all the levels of the processes when it comes to the improvement of sea registration and vital statistics. We want really to ensure that one size does not fit all, that each of the advice that we are giving fits the country's very specific circumstances. We have learned that there is no such thing that one that fits all. We just want to make sure that this message is conveyed in a very proper manner, and we would like to see this as one of the principles that will guide our future work in assisting countries to achieve their ultimate goals, which is, again, the registration, complete universal mandatory registration of all vital events. We also would like to foster a vibrant global community of practice. I believe that we have the seeds planted in this conference, and I believe that this is really something that will intellectually benefit all of us. We have all learned very different aspects that we may have not even thought of before coming here, and those that we would like to translate into the practical advice, again, for all the stakeholders. We would also like to work on strengthening donor coordination. As much as we are fully aware of the fact that these are subject to a different set of circumstances, that the point that we are fully aware of is that the donors have their own rules and regulations, they have their own mandates. However, we would like to think that there is a possibility of bringing them together and coming up with some of the coordination activities that would ensure that we do not have clashes of the donors, for example, at the country level, and that we all do commit to a full exchange of resources in terms of benefiting the country that is trying to improve its own systems. And finally, I believe that conferences of this kind provide an indispensable opportunities to harness the knowledge and experiences and provide an outstanding venue for filtering the more successful solution, research, analysis, and further development. So we would like to express so deep appreciation to the organizers and to all of us, and we would like to urge them to establish these kind of conferences as a kind of a tradition, that we have the opportunity to meet again at a certain regular period of times, to assess where we are, whether we are achieving the strategic objectives that we are underlining here, and how we can really, again, join forces in order to achieve the 2030 Sustainable Development Goals. Thank you.
Thank you very much, Sergeant, for speaking on behalf of the steering committee and the co-hosts for the conference. Any comments, questions? Okay. Total silence is a good sign, maybe. Good. Okay, so now we come to the final segment of this, which is few more last housekeeping. I promise no more. I stopped talking at 5:30 exactly, right? Yeah. So one of the announcements we have is that we do have the evaluation forms are going to be sent to you by email. They're also going to be available online. And we really strongly encourage you to please take a few minutes to fill them and share your feedback. We will greatly benefit from your feedback about this event and will help us improve content and the processes that we do these things through these events. The next, to just refresh your memory, that what we talked about yesterday, which is that the outcomes from the conference are going to be presented next week at the UN Statistics Commission, and it will be the Center of Excellence will be speaking to that. Irina will be traveling there, and will be speaking on our working with our co-organizing partners and steering committee members to pull together also a conference report that we will be sharing publicly in English and French out of this conference. So this is just a pause. It's not the end of the line on our communication on this conference. We also want to encourage you to continue the conversation online on this conference. Many of you have been sending some wonderful tweets or issuing some wonderful tweets, and please continue that have been helpful to continue the conversation, and please continue it after the conference itself as well at hashtag CRVS 2030 and hashtag ESAC 2030 in French. And my final task is I think the most difficult task, which is to say thank yous. I don't know if I will even be able to do that in the next 10 minutes or so, enough time for the thank yous. But I want to first really, on behalf of the Center of Excellence and of IDRC, I want to thank all of you for coming here and for very actively and vigorously participating in the conference. It would not have been successful, it would not have been useful without your active participation and your willingness to challenge yourself and to really be open to new ideas and new friendships and working relationships. So I really want to thank you all very much for coming here. And also, well, not also, I want to give you a round of applause, please, for everyone here. And then there are so many special thanks, but I will give a second special thanks to the moderators, chairs of the panels, the labs that have really worked for long weeks before the conference to organize the panels, to organize the labs, to make sure that the various perspectives are represented, or as many perspectives are represented as possible, as much as possible gender equitable, and the representation of the panels and the chairing. So I really thank you so much. You have worked so hard, and I know during the conference and probably still after the conference, there's some homework probably for you to do. So I really thank you so much as chairs and moderators. And then there has been a whole army of note takers for this conference. Some, well, all volunteered. I won't say anything. They all volunteered for it, coerced maybe, but there's been really a tremendous amount of work done to document this conference in a way that will hopefully be helpful for us to build on for the future, to continue the conversations, but also would be helpful for others who have not been able to come to the conference. So note takers, can I ask you to stand up, please? Note takers. And these are, I think these are just some of them. I think some of them have already lost their energy, so they're already not here. Yeah, this is why we have to wrap up in the next few minutes. I also want to thank our interpreters. They have really worked so hard with us. I know, I don't know how they kept up with the labs and the panels and peoples and microphones off and on all the time. Some people speaking fast, some people not speaking fast enough, all of that. So thank you so much for our interpreters. They have made the days very, very wonderful for us. Our facilities managers are not here with us in the room. I don't know, they're not far from here. But I also want to tell you that they have been extremely flexible, extremely accommodating. We have changed so many things in this and the plans for this meeting, and they have just given us the wonderful, and maybe we have a representative there. We have had just wonderful cooperation from our facilities management here, and we just want to say we could not have had this meeting run this smoothly and this warmly without their contribution to it. So I want to thank them very much also on your behalf. And the food was delicious, of course, so that helps, right? And then I want to really thank also my team, specifically from the Maternal and Child Health Program. Without their hard work for almost a year, this event took almost a year from conceptualization to realization. And they have worked and tried as hard as possible, or as much as possible, to listen, to take advice from everyone, and to take guidance from everyone on how to make this event a really a useful event for everyone. So I want the team to stand up to say thank you from the bottom of my heart. And I know she's going to kill me, but I want to single out one person whose last day with the team is today, for the happy reason that she is almost going to give birth. So today she stayed along just for the conference. So she has played a tremendous role with the in terms of the preparations for the conference. So Kristen, please stand up. Don't. And don't kill me. Also, we had wonderful teams for the IT teams, electronics teams, and also we have Comcast here somewhere that have been also helping us with the website, with the summaries of the material and everything. And also we have Annika, who has helped a great deal in the preparations for the conference and for the communication around the conference. And we also have the steering committee to thank. I mentioned them yesterday. I want to recognize them again for the wonderful guidance they have given us for making this conference what it is, and hopefully for follow-up later on. I have nothing else to say except to say I hope to see you again here in Ottawa soon. And spring, summer, winter, we have a whole bunch of variety of things to do in different seasons. Hopefully you took advantage of some of your time here to enjoy at least going to the Parliament or going to see the river. And hopefully we'll see you here again soon. Thank you so much, everyone.